This is our second gubernatorial candidate of the morning. Big doings here on Morning Meeting.
Absolutely. So it's Joseph Avallone. Thank you so much. He's in studio joining us. We really appreciate you coming here.
Not Avallone, which is what I thought.
I thought so too.
Yeah.
So I'm glad we've been schooled.
And what he missed before I came in, and luckily he did, I said it sounds like it rhymes with baloney.
I actually said it sounded like a delicious sea treat, which is abalone.
Oh,
yeah.
okay.
That's right. I'm going with you, Hillary. That's great. It's a specialty.
So thank you so much for coming in here today. We really appreciate it. So you are the second person that's a CEO of a major, or a former CEO of a major healthcare company here in Massachusetts. You were the CEO of Blue Cross Blue Shield of Massachusetts.
Of course, Charlie Baker being the second, right?
Exactly. Another one of your opponents says that that's actually the worst thing we can have is a healthcare CEO coming in and becoming governor of Massachusetts, because it's these big healthcare companies that are the problem and they won't be part of the solution. What do you say to that?
Well, first of all, nice to be here. Nice to meet you, Jack.
We jump right in with the questions.
Yeah, we
do appreciate you coming into studio.
Thank you so much for
I'm happy to be here. Well, first of all, just to set the record straight, I was the chief operating officer at Blue Cross and Blue Shield in the 90s. And I have also led a large global international medical research company for the last 7 years, a large global division at Par Excel International. So I've had a large career over 30 years as a healthcare executive running very large organizations. Mm-hmm. In the case of Par Excel, we have 15,000 employees in 50 countries. So I have a large global workforce, and a lot of why I'm running for governor is around what I see are the work skills that are in other countries and how we need to do better with our work skills here in Massachusetts in order to create new jobs, because jobs is really the key. But going back to your question, yes, I did. I was at Blue Cross during a time in which we modernized Blue Cross back in the 90s. We created HMO Blue, which probably most people in the state are familiar with, controlled our costs, grew many jobs. So I would say that was a pretty successful time for Blue Cross.
You know, the budget of Massachusetts is about $34 billion. The biggest line item in that is $12.1 billion, which is healthcare costs in Massachusetts. What will you do to try to rein in the spending of healthcare and lower that number?
Yeah, this is a huge problem for the Commonwealth, and not just for the state government. As you rightly point out, it's a big part of the budget, 40% of the budget, but also for families and businesses, and well over a decade. So we've had this rise in healthcare costs for probably 12, 15 years, year on year, and it's not really, and that was long before we got to the universal access system that we've had now for 7 years. So the issue that is that needs to be addressed is the patterns of care, the way the health care gets delivered underneath the insurance mechanism, whatever the insurance mechanism is, whether it's Medicare or Medicaid or Blue Cross or Harvard. It's how the care gets delivered underneath, which means how the doctors are organized and collaborate and make decisions based on optimal care versus an uncoordinated system. Right now we have a very uncoordinated system of health care that's essentially driven off a fee-for-service payment system. Mm-hmm. Both of those are failing. The fee-for-service payment system just has doctors have to see more patients in less time, which none of us like, and nor do they, or it requires them to do more procedures just to maintain the same standard of living. This is all the wrong incentives, and where we have to move as a healthcare system is towards what are called organized systems. And those organized systems are larger groups of doctors that all agree on best practices that manage a population of patient. And then that starts to change all the behavior. It starts to have the large doctor organizations focus on the outcomes, the medical outcomes of those patients, so we end up with better care, more stable cost structure, and effectively a better life for doctors.
Now, you're running as a Democrat, which is a pretty crowded field at this point. I mean, you've got Grossman and Coakley and Berwick, I believe, are also in there. Are you concerned at all? I mean, certainly Democrats had bullied other folks when Elizabeth Warren was running sort of off the ballot. Are you concerned that during the Democratic convention you're going to have difficulty getting on the ballot?
Well, we have a long tradition of electing outsiders from the governor's office, so citizen politicians. I view myself as a citizen politician. I've had been in the healthcare industry effectively for 30 plus years, between being a surgeon and a healthcare executive over those years. But so have many of our other governors. So Deval Patrick, being the latest example, came from outside, from the private sector, and so did
some consider
Weld
him
and
to be a
others.
little bit of an anomaly, though.
Well, so Governor Weld did the same thing. Actually, so did Governor Romney. So we have a long history of electing people from outside of the insiders in the party and outside of the political professionalism, if you will, kind of conventional politicians. And I'm following that road. So I, like Governor Patrick, like Governor Weld, started 18 months before the election. I started last January. And I've been in 113 cities and towns so far. I'm now running full-time as of October 1st. And that is what you have to do as an outsider. You have to build your own base of support around the state. But this is a state that not only you can do that in, because it's very politically attuned, but also small enough, but it's also a state that wants that of their governors. They want you to be out there standing in every town with them, hearing their needs, hearing their concerns, and that will make me a much better governor for having done it. So I applaud the idea of coming from the outside. I think we should have more politicians that do that.
I would argue he looks like a governor. That helps.
Yeah, you do sort of have that look.
You do have that gubernatorial look.
I'll
ask this.
Makeover.
How will you differentiate yourself with Charlie Baker? I mean, you sort of have this similar healthcare backgrounds that you're coming to the race with. I mean, clearly, obviously, you're Democrat and Republican, so there's.
I mean, even Evan Falchuk, though, for that matter. I mean, he comes from the healthcare field as well.
Well, I'm shorter than Charlie. That'd be the first thing to notice. I have managed large organizations for a long time, and I've created thousands of jobs over 30 years. And as I've been around the Commonwealth, now 113 towns, over 300 events, and some towns many, many times, I've spent a lot of times in the gateway city.
Sort of have this similar healthcare backgrounds that you're coming to the race with. I mean, clearly, obviously, you're Democrat and Republican, so there's.
I mean, even Evan Falchuk, though, for that matter. I mean, he comes from the healthcare field as well.
Well, I'm shorter than Charlie. That'd be the first thing to notice. I have managed large organizations for a long time, and I've created thousands of jobs over 30 years. And as I've been around the Commonwealth, now 113 towns, over 300 events, and some towns many, many times, I've spent a lot of times in the gateway cities. And this race is going to be about jobs and where we're going to find new jobs. That's what everybody cares about, and I don't blame them. A lot of the older industries are in decline. They were in decline before the recession, and they're not coming back. So rebuilding new industries and new job opportunities in those industries is going to be the key focus for the new governor. And I've done that over 30 years. I've done it with the global workforce. I've done it at Blue Cross and Blue Shield. I did it as running a healthcare startup for 7 years here. So
how does that differentiate you from Charlie Baker?
Well, I don't know how many jobs Charlie's created, but he did a tour at Harvard Pilgrim, and he worked in the state government. So I've created a lot more jobs over a lot longer time, over many different organizations.
You're talking about jobs and creating new jobs. Can you talk about some of the areas in the Commonwealth where you think that there could be some expansion, where we could add more employment opportunities?
Absolutely. I think this is what the next governor needs to focus on. What I've found in my own business is that what we need to do in Massachusetts is use our community and state colleges and even our vocational schools in a much more strategic way going forward. I mean, we have a wonderful asset, 24 campuses for the community and state college system. We have the university system on top of that. But we don't use it strategically. It's pretty semi-autonomous. They each have their own budgets, their own boards, their own presidents, their own missions in many ways. And we've taken some initial steps towards coordinating that better. But I can tell you from my own experience around the world that other countries, other countries work much more carefully with emerging industries to try and understand the critical work skills, the middle management skills, and make sure that they have them. So in my own case, in Par Excel, we have academies with some other university systems around the world, in Germany, in Singapore, Japan. And in those cases, they try and work with us to understand the skills we need. They then build it into their curriculum. They become either certificates or part of their graduation. We then have internships, and we hire them in. Well, I had to form our own program right here in Massachusetts with Salem State, because right here in Massachusetts, we didn't have enough of a certain kind of employee to help us run these large clinical trials that we run. So we have a program now at Salem State where we help provide the curriculum and help them understand it. They then build that into their curriculum, and then we've hired in those folks that have graduated. The state has to be much more proactive and strategic now in understanding these newer industries, and then building the skill sets, the so-called middle skill sets in. Then we can bring companies here, because companies today can be almost anywhere, and they can be almost anywhere in the world. Unfortunately, we're not just competing with Pittsburgh or Cleveland anymore. We're competing with many places around the world. So this is what we have to focus on. And these jobs are in smart manufacturing, it's light manufacturing, complicated, more complex manufacturing that can come here, and it can be in our older urban environments. and certainly life sciences, which we have a pretty strong position in already. But for example, we don't do much biotech manufacturing. We could do a lot more of that here if we had these kinds of skills. Software, telecommunications, and many others. This is the future for us, and it's not just in Boston. It can be around the state in these other environments as well.
You talked about jobs being a big issue, but when Charlie Baker was here, he was saying the other major issue is education. Do you have kids?
I've got 3 kids.
Okay. Did they go to public school?
They all did.
They did. What do you think could be done?
It was great.
Well, they were in
fantastic.
Wellesley, and Wellesley's one of the best public schools in Massachusetts. What did you learn from your kids going to Wellesley Public School that you would like to implement throughout the entire state?
Well, first of all, education, both the higher education that I was just talking about and K through 12, are completely our future. I mean, we don't bring these newer industries here unless we're a knowledge economy, unless we essentially have the workforce and the skill set and the people that can do it. So that is critical, so I couldn't agree. And as I've been going around the state, I have seen the flaws of some of our education systems. So I'm going to be publishing my education policy in about a week. And you're going to see there's 2 key goals.
Oh, you can't give us a sneak peek? You can't break
I can tell you a
news
little
here
about
on
it.
Morning Meeting?
I can tell you a little about it. But what a major focus is going to be closing the achievement gap. So we have, a fairly good public school system by national standards, obviously, and even now by international standards. So I think that's due to a lot of good hard work by lots of teachers, lots of school district leaders, and certainly the state government itself leading the effort on reform. So I give credit to a lot of that over a 20-year period, but that the achievement gap is just way too large. So I've been in these towns, and these low-performing schools are not serving our kids, and there is no way that literally thousands of these kids that don't even get through these schools, let alone the ones that get through, can have a meaningful life in the current environment, let alone in the future environment. So closing the achievement gap is going to be my #1 priority, and how I do that is going to be in this policy, which you'll see. But it's going to be going after the things we know work, the things that have the biggest impact, and that's going to include pre-K education, and it's going to include lengthening the school day in some of these districts and certain schools to build in more enrichment programs, the things that we know are tried and true. But we have to do it. It's not so much how to do it, it's having the political will to do it. And if we don't do it, we're not serving these kids in the Commonwealth. And we need to serve all of our children. This is what we're really all about as a Commonwealth.
Hillary was talking about the crowded Democratic field, and that also means when there's a crowded Democratic field, it's hard to raise money. Are you planning on using a lot of your personal money to run for governor, or how much money are you hoping to raise?
Well, you have to raise a lot of money to run for governor, and I knew that going in, and I certainly wouldn't have done it if I didn't think I could raise the money. And so far, so good. I mean, the campaign.
How much have you raised so far?
It's between $320 and $350. But I'm raising the money, and you can look it up. It's on the.
Right.
It's on but I'm raising money to run my campaign. My campaign is a grassroots campaign, so I'm not raising lots of money to be on the media. Be in the media. I'm not going to be, advertising anytime soon. What I'm running is a grassroots campaign, so I need some field staff and some ability to make sure I'm in every city and town, make sure I'm talking to all these voters, and that's what really counts.
Are you using your own funds as well?
Yes, and you can look that up too.
Right.
I've used some of my own funds in the race so far.
And what about trying to get endorsements? How important do you think are endorsements for you in your grassroots campaign? Have you been able to lock any up, or is that not a focus at this point? Is it more kind of going door to door and going to senior centers and things like that?
It's really neither of those. It's endorsements. It's too early. People really aren't focused on the governor's race really yet, especially outside of the core insiders. And it's also too early for straight retail going door to door. What it isn't too early for is engaging citizens who have been active, who are interested. So that's lots of city committees and town committees of the Democratic Party, lots of House Party events and other kinds of forums. And that's really what I do. I mean, it's, many events a day, all weekend, and certainly all day long. Now, it used to be just nights and weekends before. So this is the way you get there. And this is the tried and true path. This is the way people have won before.
All right, Joseph Avallone, thank you so much for coming in. We really appreciate it. Of course, we're trying to hear from all the gubernatorial candidates, so always good to have you here. Next time, we're going to try and rope you in for political theater. We had Steve Grossman doing The American President, I think, last time we did it. So we're
you
going
need to set it up. So basically, Hillary's a huge movie buff, so she asks politicians to say, what is your favorite movie? They print out a scene from the movie, and each person gets to play a character. I am not a part of it because I'm a terrible actress.
Right, you've actually done some on your own, spontaneous political theater.
Well,
where she played Guy Glodis. And Joe
Yes, I know,
Battenfeld
right?
played Mayor Menino, and it was
wow.
fabulous.
Yeah, but that was just me mocking Guy Glodis because it's an easy person to mock. But who you had a great one with Senator Brownsburg.
Oh, so State Senator ran for Congress, as you know,
Yes, I
William
know.
Brownsburger. He said his favorite movie was The Life of Brian. But we ended up doing the night Monty Python. Why can't I think of those? Oh, The Holy Grail.
Oh, yeah.
So we did The Knights Who Say Knee.
wow.
So those are still available somewhere online. Which that one was
that was
amazing
amazing.
because he really committed. He really committed to the funny voice and the knee. But anyway,
I don't believe that
God
Steve
bless him for
Grossman's
that.
favorite movie is The American President.
know.
I've gone on record saying that. I
Yes.
believe it's Nerds.
I'll
You're
tell you
brutal.
mine is Saving Private Ryan. I think it's a great movie.
that'd
That
be a
is a good
good one.
movie.
That's a
Yeah,
good juicy
I-
one. We'll figure out some roles from there.
I love the reluctant hero, the citizen
Yes.
soldier. That was a great
So
movie.
you'll play political
Good.
theater with Hillary next time you come on?
Well, I don't know. I'll give it a shot.
You seem like you'd be a natural. All right. Well, listen, thank you again for coming in. We really appreciate it. Of course, I'm Hillary Chabot here with Jacqueline Cashman. This is Morning Meeting.